Redwood Clinic, we work with a lot of patients who have chronic pain and trauma that has been locked into their bodies. I had a chance to talk with Matt Green, a chiropractor in the BNI network, the other day, and we were talking about this type of thing in real-life situations and exactly what can happen over time as these little traumas can build up and thus create a situation where people come into me or come into chiropractic for help with these chronic intractable pains that then create functional problems in all parts of the body. In a lot of different systems, it may have an influence on the brain with brain fog. It may have a problem. It may have an effect on the lungs with asthma or digestive issues or low back pain. So let's go ahead and hear what Matt and I talked about the other day.
Okay, hi, I'm Dr. Matt Green with Ashby Chiropractic and Health Center. Jay and I were just talking, and I was just sharing a story about my daughter, who's 2 years old, who we were at this water park, and she was swinging on this rope, like forward and back, like this, and then all of a sudden she went too far forward, and she went, and then she slammed her head into it. And I picked her up, and as she was crying, I was palpating her, was feeling her upper back, and I could feel it was a lot tighter than it was before. Gave it a little tiny adjustment, and then all of a sudden it felt soft again. And, you know, the significance of that is that how many people do us practitioners see that just have upper back pain that they don't really know where it came from. And so here it is, my daughter, if that didn't get corrected at that point, and just that stayed there, the spasm on top of spasm on top of spasm, who knows when she was 10, 20, 30 years when that was going to come. But eventually some kind of pain or dysfunction would come from that initial visit, that initial incident. And well, just how exciting that is for my daughter, that she's not going to have those cumulative traumas all the way through a year, that she'll always get checked.
So because Matt's so sensitive, he could feel that contraction up in the upper back region and realize that this whiplash injury was creating an impact. And over time, if that hadn't been unwound at the moment, it may have gotten stuck and created these problems farther down the line. So that's one of the things why, when we're doing health history, why I like to find out the different traumas a person has had, because these do have a positive, they positively influence the body. In a negative way, over time it piles up, and that can decrease function, and then people develop symptoms from it. So thank you again, Matt, for sharing this with me and with the rest of the patient population.